Imagine walking through a quiet forest at dawn, the air is cool, and the ground is covered with fallen leaves. As you move forward, you notice a narrow path leading to a small clearing. At the entrance, a wooden sign swings gently in the wind. It reads, "The hare's energy cache hers disease." Immediately, your mind should connect the word hare, hers. This is your anchor for hers disease, glycogen storage disease type VI. Now, step into the clearing. You see a determined hare standing in the center. He looks strong, alert, but also slightly tired. Strapped to his back is a massive sack labeled energy. The sack is overflowing with stored fuel, but something feels off. The hare is carrying all this energy, yet he still looks hungry and fatigued. This is the key paradox. In hers disease, energy is present, but it is trapped and cannot be properly used. Now, look closer at the sack. Inside it are tightly packed bundles labeled glycogen. Normally, glycogen is broken down into glucose to provide energy. But here, the bundles are stuck, locked in place. Above the sack, a sign appears. Trapped energy, liver phosphorylase defect. This is the central mechanism. In hers disease, there is a deficiency of liver glycogen phosphorylase. This enzyme is responsible for breaking down glycogen into glucose-1-phosphate. Without it, glycogen cannot be converted into usable energy. So the liver stores glycogen, but cannot release glucose effectively. Now, look at the hare again. Despite carrying a huge energy reserve, he pauses frequently. He looks weak, slightly dizzy, and slow. This represents mild fasting hypoglycemia. Because the liver cannot release glucose properly during fasting, blood sugar levels drop, but only mildly, not severely. This is an important exam point. Hers disease is generally less severe compared to other glycogen storage diseases. Now, as the hare exhales, you notice something unusual. A faint mist forms around his mouth, carrying a sharp, fruity smell. This is ketosis. Because glucose is not readily available, the body shifts to fat metabolism, producing ketone bodies. So remember, mild hypoglycemia plus ketosis equals key metabolic feature of hers disease. Now, shift your attention to the hare's abdomen. It looks enlarged, slightly swollen. As he walks, the weight of the large sack seems to pull his body forward. Behind him, you see a large wooden crate shaped like a liver, also labeled energy. This represents hepatomegaly. In hers disease, glycogen accumulates in the liver because it cannot be broken down. This leads to liver enlargement. So the visual becomes clear. Trapped glycogen right arrow accumulation in liver right arrow hepatomegaly. Now observe something interesting. Despite his fatigue, the hare's legs are powerful, muscular, strong, agile. He suddenly sprints forward with surprising speed. This is a very important contrast. In hers disease, the defect is limited to the liver. The muscles are completely normal. Muscle glycogen phosphorylase is intact. So while the liver struggles to provide glucose, the muscles function normally. This helps you differentiate hers disease from other glycogen storage disorders like McArdle disease, where muscle is affected. Now imagine the hare trying to use his stored energy. He opens the sack and pulls out glycogen bundles, but cannot convert them into usable fuel. He looks confused. A small thought bubble appears above his head, filled with question marks. This represents the block in glycogen breakdown. The energy is there, but inaccessible. So the body compensates by using alternative energy sources, leading to ketosis. Now pause and take in the full scene. A determined hare, carrying a massive energy load, yet still tired. A swollen liver due to glycogen accumulation. A blocked pathway preventing glycogen breakdown. Mild hypoglycemia, especially during fasting. Ketosis due to alternative metabolism. And strong, unaffected muscles. Now, let's walk through the story again so it becomes unforgettable. You enter the forest clearing and see the sign, "The hare's energy cache hers disease." The hare represents hers disease, linking the name instantly. On his back is a huge energy sack, representing stored glycogen. But the energy is trapped because of a liver phosphorylase defect. This leads to inability to convert glycogen into glucose-1-phosphate. As a result, the hare becomes hungry and tired, showing mild fasting hypoglycemia. His breath carries a fruity smell, indicating ketosis. His abdomen appears enlarged, representing hepatomegaly due to glycogen buildup. Yet his legs are strong and powerful, reminding you that muscle is unaffected. So the entire disease revolves around a simple concept. Energy is stored, but cannot be released. And that is the essence of Her's disease, Glycogen Storage Disease type VI. A liver-specific phosphorylase deficiency, leading to trapped glycogen, hepatomegaly, mild hypoglycemia, ketosis, normal muscle function now. Lock this image in your mind. A strong hair, burdened with energy he cannot use, moving forward but always slightly tired. That is Her's disease.